Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are talking about private equity. Partnering with a private equity firm is work, but it can be beneficial to providers and patients and ultimately the healthcare ecosystem. There's a lot of skepticism in this space and questions if patients truly benefit from the partnership. So it is crucial to first discuss and align the vision with future partners in order to reach those full potentials. So we'll unpack this today. So today I'm speaking with Dr. Kartik Giri and Josh Ginsberg from the Heart House of New Jersey. Thank you all for coming in and talking about your experience partnering with the Cardiovascular Associates of America. So appreciate this discussion. All right, I'm interested to hear your perspective through years of consolidation changes, first with hospital and health systems, and now with private equity. What drove you to consider a partnership with private equity?
It's a great question. So we've been through all the ups and downs in the last 20 years of consolidation, and our fundamental goal was to remain independent. That sort of drove everything, and private equity kind of came to us late. They've been approaching us for years, but the newest rendition got our interest because it stressed some of our key fundamentals, which was physician autonomy and building a platform with the physicians leading it, which we feel is what's going to be best for healthcare as we move forward.
Yeah, how is that relationship, how has it been navigating? Is it what it seemed to be?
It's been great. We're about a little over a year into it, and everything that we joined for is coming to fruition, like independence. We have 23 other member organizations with great leadership, so we have constant exchange of ideas to help our practices on a day-to-day level. And then the resources of the PE firm and the connections that they have gotten us seats at the table that we could never get for value-based care and patient population management and stuff like that.
Yeah, it sounds like good that you waited to find that good partnership.
I think so, yes.
Yeah, and those discussions beforehand. We have an increased demand from patients. Cost, we're always talking about they're going up, and we have a shortage of cardiologists as well. So value-based contracting has been one of the models discussed to address this complex ecosystem. So how will your partnership with CVA USA increase your participation in value-based activities?
So we're really excited about the opportunities that we have with this partnership. So I think one of the most important things that we as a practice have always tried to do is develop relationships with our payers. And with the relationship with CVA USA, we've gotten access to payers. So one of the most important things is when you want to develop a value-based care plan, it's a partnership. You have to have a partnership and a relationship with the payer. And so previous to this, we struggled with getting our payers to actually take our calls. And with this relationship that we have and the expertise that comes with CVA USA, we've been fortunate enough to actually get in the door with 3 of our largest payers. So that's a critical component for us.
Did you expect that?
I don't think we necessarily expected it so quickly. Right. I think one of the things that we were excited about was at some point in time down the road that this would be part of our venture. And that's one of the reasons, again, why we, as Dr. Giri said, that we joined this particular platform was the access as well as the expertise. We know that we're a good practice. We serve our patients, with great customer service, great clinical service, but we didn't have the expertise to roll out a value-based care plan. And with a partnership like CVA USA, they have the access and expertise to not only get us in the door, but get us prepared for having these negotiations, these discussions, and then really operationalizing it.
All right. So what are some of the benefits for those involved in a private equity relationship in cardiology specifically?
So the latest rendition of private equity offers a lot of benefits. It offers a partner that has capital, which helps you, expand your practice. It really helps with hiring. It also allows a deeper bench, per se. They have assets at the contracting level, at the payer level, at the economies of scale level that we wouldn't have. And it's aggregated groups. I mean, we're 23 groups and growing. We're already at 370 docs. There's value in that. Not only just sheer size, but the exchange of ideas and best practices is flowing now. So it's really very helpful.
I think as an administrator, when I talk to colleague groups within CVA USA, I say that in the MedAxiom world, we used to share ideas because collegially it was the best thing to do, right? We would share ideas. Now with CVA USA, not only do we share ideas, but we all benefit from those shared ideas because we're now all on the same platform. So it's been a tremendous help for us.
All right, let's talk about the patients. You know, I know we always come back to that in these discussions. So how has this experience been for patients?
I would say seamless to this point. All of our groups have maintained, their separate identities. We are not corporatized at all. We're our own practices. We view ourselves as highly independent still. So seamless for the patients. Their bills haven't gone up. They pay the same to see us as they have. What it has done is improve access. We have novel ideas on, expanding care, doing remote monitoring, remote patient monitoring, physiologic monitoring, things like that. So right now, I would say the effect is seamless. Hopefully, if you have me back here in a year, I would say it's great because we've cast a value-based net around our population.
How about the relationship with the health system?
I think we've always maintained good relationships with our health systems. We go to 4 different health systems, all within a small geography. And so it was important for us to maintain these relationships. So the relationship with CVA USA has not impacted our relationships with our health systems. As Dr. Giri said, we're the heart house. We're not CVA USA, the heart house to the local area. We're still the heart house. And when we meet with our local CEOs and service line leaders, we're the heart house. And so that has not changed at all.
And it sounds like when you entered into this relationship, you kind of stood your ground and said, this is what we're about, and we will only enter this relationship if we continue to be able to operate that way.
That's correct.
Yeah.
We waited, and our CEO, Tim Atterbury, is highly respected in the space, and it was his idea to create a model that would empower physicians to sort of shape the future of cardiology. That's why we joined.
Yeah, this is a nerve-wracking space for some people. What advice would you give to your peers who are considering a partnership?
I would say that I think you need to pick your partner and spend a lot of time understanding what their core values are. As Dr. Giri just referenced, our CEO, Tim Atterbury's, as well as our sponsor, Webster's main platform was they're going to leave the autonomy back with the practice so that we have the ability to continue to be the heart house and work like the reason why they wanted us. And so that was critically important to us was we want to still be independent. We want to work like we're independent, but have access to a partner that has the expertise that we didn't have to help us get that much better. And so as people are evaluating whether they want to go down this path, I think it's what are the core values of the platform that you're looking to join and who's leading that. With Tim, he was a colleague of mine, and he's then advanced to a lot of different roles, from hospital CEO to the president of the ACC to now starting this venture. And so Tim knows the cardiology space and he knows it very well. And so having somebody as a leader of the group that you're going to join, know the cardiology space and not just know business was something that was very attractive to us.
Yeah, so take the time and have those real conversations and first know your mission and your core values so that you can make sure they align. Thank you both for joining us today.
Thanks for
really
having us.
shedding some light on a topic that can sometimes be a little scary.
Appreciate it.
Happy to be here.